Hello and welcome to our Fascial Fix for recovery from respiratory illness. So you may have recently have had a respiratory illness. That could have been a virus, a chest infection, or maybe even long COVID. Or you may have an ongoing condition such as asthma or COPD. Whatever it is, it usually involves tightness of breath, particularly in the top of your chest, a tight feeling, and also coughing. And over time, what that starts to do is it tightens up this area, so the muscles and the fascia in this area start to get tight. In particular, there are muscles that attach into your top ribs and come up into the sides of your neck. And when you're having difficulty breathing or you're coughing a lot, these can get very tight. They're called the scalene muscles, and they're known as accessory muscles to breathing, which means they're not normally used in breathing unless you're having issues such as shortness of breath. So what happens is that these muscles get tight, your pec muscles in your chest also get tight, and this can start to compress on the nerves for your arms. Now that may sound a bit strange, but actually your arm nerves start here. They originate from your spinal cord. They come out through the scalenes, the muscles in your neck. They come across your chest, through your armpits and into your arms and your hands. So if all of this gets tight here, it means that you can start to develop symptoms such as numbness, tingling, pins and needles in your hands and your fingers. And this can be due to the tightness that's up here in your chest. So in this video, we share some exercises that can help to release around this area and take the pressure off your hands, your fingers and your arms. In this exercise, I'm going to do a doorway stretch for the front of my chest. To do this, find any convenient doorway and just place your hands on either side of the door frame at any level that feels comfortable for you. And once you've done this, then just take a step through the doorway. It doesn't matter which leg you use to go first, but if you're doing it regularly, then maybe swap your legs to keep everything balanced. And once you're here, just allow your body to relax and just sink through the doorway. So as you're doing this, you'll get a sense of stretch in your chest. And this will start to open out the front of your chest, which for so many people gets very restricted, particularly when you're doing a lot of fine work in front of you, for example, computer work. And this just allows the tissues to start to release and open out. And in turn, opening your chest out helps your shoulders to drop back and down into the position they should be in. So as you're here, as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to release and let go. The muscles, fascia around your chest can all start to release. And you can experiment with placing your hands in different positions on the door frame. So for example, you can place them further up, which stretches more into your shoulders, or you can place them further down, where you get a stretch more into your chest. So it doesn't matter where you have your hands, as long as it's comfortable for you and you get a sense of stretch and opening in your chest. This is also a really good exercise to do if you've had any kind of respiratory infection, so where you've had any issues with breathing, or if you have a longer term respiratory condition. Some people find that this is uncomfortable to do with both arms in position, in which case you can do this one side at a time, and I'll show you this next. To work on one side of the chest at a time, just lean one shoulder in against the door frame. Let your body relax onto the door frame and then just turn your body away from this side. So this will create a stretch that you'll feel across the side and front of your chest. By turning your head, you're creating a slightly deeper stretch. And as long as you're here for at least a couple of minutes, this will help to start to release the fascia and the muscles in the front of your chest, your shoulder, and even up into your neck. And once you've been here for at least a couple of minutes, then you can change over and do the other side. In this exercise, I'm going to do a towel stretch. So to do this, you need a big towel like this. This is a bath sheet, and I'm going to roll it up into a big sausage. You can also use a bolster, or some people like to use a foam roller, but that can feel quite firm and maybe too much for a lot of people. So once this is rolled up into a big sausage, I'm going to lie on this on my back. And the important thing is to have my head and my bottom actually on the towel. So when you're here, just allow time for your body to relax onto the towel. Particularly allow your back to just loosen. If it feels comfortable, you can straighten your legs or you can keep your knees bent, whichever works best for you. Just have your arms by your sides with the palms facing up towards the ceiling. The towel stretch is something that you can do for a bit longer than the other exercises, as this is a whole body relaxation. What this does is the towel lifts your body a few inches off the floor, and then gravity starts to pull everything back down towards the floor. In doing this, it opens out your chest, it opens out your back, and it opens out your pelvis. So whatever is going on in your body, it's a really good way of opening and relaxing everything. We spend a lot of our lives doing things in front of us, which tends to tighten the front of the body. And this is a really great way of undoing some of that restriction. The other benefit of this particular exercise is the pressure that the towel puts on the base of your skull and on the base of your spine. These are areas where there are clusters of nerves for the rest and digest part of your nervous system. By lying here with a sustained pressure on these areas, it helps to stimulate rest and digest. Many people spend a lot of their lives in fight or flight, which is the other part of the nervous system, and that is triggered by stress and by pain. So sometimes your rest and digest isn't working as well as it should do, and this is a nice way of helping to re-engage it. When you're here, then if it's comfortable, stay here for 10 to 15 minutes. Maybe put on some relaxation music, or maybe an audio download, a meditation or relaxation download, whatever is good for you. The main thing is just to allow time for your body to start to relax. It's a really good exercise to do at the end of the day, as it can help with sleep. In this exercise, we're going to do some fascial breathing. So this is basically relaxation breathing, which is good for everybody. So I'm going to lie on the floor to do this, but you can equally lie on your bed at home, and you can also do this seated if it's preferable for you. So lying here, I'm just going to allow a few breaths just to
let my body relax onto the floor. If it's more comfortable for you, you can put a pillow under your head. You can have your legs bent like I've got, or you can have your legs flat. Some people do this in conjunction with the towel stretch, so whatever's good for you. So there's a good way of starting the exercise. I'm going to place my hands on the bottom of my rib cage. So they're half on the ribs and half on the top of my tummy. And so I'm going to just notice how I'm breathing. I really want to breathe into my hands. So breathing in and out. And feeling my hands move as I breathe. So as I breathe in, my hands are moving out and up. And as I breathe out, my hands are moving down and in. And that's following the movement of the rib cage. So that's the first step, which means that you are breathing into your diaphragm. And that is the start of relaxation breathing. Many people breathe into the top of the chest, and that's called shallow breathing. So with fascial breathing, what you want to do is breathe in for a specific count and breathe out for a specific count. And your in-breath should be slightly shorter than your out-breath. So we're going to start by breathing in just for 1, 2, 3, and then breathe out for 1, 2, 3, 4. Breathe in, 1, 2, 3, and out, 1, 2, 3, 4. In, 1, 2, 3, out, 1, 2, 3, 4. In, 1, 2, 3, out, 1, 2, 3, 4. Keep breathing in and out, following that count pattern in your head. And the reason that it is good to do breathing like this is that it starts to encourage your vagus nerve to activate. The vagus nerve is a nerve that comes from your brain and it travels through your body. It enervates your lungs, your heart, and your digestion. And sometimes, if you have pain and you're stressed, the vagus nerve can be switched off or its function can become impaired. And particularly when you're stressed, you tend to shallow breathe in the top of your chest. That also switches off the vagus nerve. So breathing into your diaphragm, using the count of the in-breath of 1, 2, 3, and the out-breath 1, 2, 3, 4 can help to start to stimulate vagus nerve function. And that in turn stimulates the rest and digest part of your nervous system, and it helps your body to re-regulate itself and to perform a lot of the repair and nurturing functions that it needs. So if you can, do some fascial breathing every day. Maybe set a timer for 5 minutes to start and gradually build the time then you will find it helps to relax your body, your mind, and that in turn helps to reduce the pain and the stress that you may have been feeling.